If you have type 2 diabetes or you're struggling with high blood sugar, then today's video may completely change the way you think about one of the most common drinks in your kitchen. Most diabetics focus on avoiding sugar, cutting carbs, and taking medications. But very few realize that the type of milk they drink every day may have a surprising impact on their blood sugar, insulin response, cravings, and overall metabolic health. In today's video, we'll reveal the milk that many health experts believe can be a smarter choice for blood sugar control, discuss the science behind its benefits, and explain how it may support a healthier lifestyle for people with type 2 diabetes. Be sure to watch until the end, because we'll also uncover several common milk mistakes that could be causing your blood sugar to rise without you even knowing it. I need you to stay with me because by the end of this video, you're going to know which milk hurts blood sugar, which milk only pretends to help, and which one I would choose if I wanted the strongest everyday advantage. Before we begin, please subscribe to this channel and join our community for clear, life-saving health guidance made for you. Now here's the truth almost nobody says clearly enough. No milk on earth can magically cure type 2 diabetes by itself. If someone promises you that one drink alone can erase years of insulin resistance, they are not protecting you. But there is one kind of milk that can fit beautifully into a blood sugar-friendly routine, support better habits, and help move some people toward the kind of weight loss and metabolic improvement that makes remission possible. And that word matters, a remission, not miracle, not overnight reversal, not throw your medicine away by Friday nonsense, remission. That means blood sugar returning to a non-diabetic range and staying there for a meaningful period without diabetes medication. That is a very different claim. And it matters because type 2 diabetes is not some little sugar problem floating in isolation. It is a disease tied to insulin resistance, excess body fat in the wrong places, impaired pancreatic function, inflammation, and daily habits that repeat themselves meal after meal. So when people ask me, "Doctor, what milk should I drink to reverse this?" what they're really asking is, what choice can help me stop making things worse and start making things better? And that is exactly the question we're going to answer today. Because I've watched this happen again and again, especially with seniors, someone gives up soda, and that's wonderful, but then they replace it with a sweetened oat milk latte every morning. Or they stop eating dessert, but they start drinking 2 large glasses of flavored milk at night because they think liquid calories don't count the same way. Then they look at their glucose numbers and feel betrayed. They say, "I don't understand, I'm trying." And I believe them because they are trying. The problem isn't always effort. The problem is often hidden sugar, hidden starch, hidden calories, and the dangerous myth that all milks are gentle on blood sugar. They are not. Some are quiet saboteurs, some are neutral, and one, if used correctly, can be genuinely helpful. Before I reveal the milk I would put at the top of the list, I need to show you why the others can be such a trap. Because if you don't understand the trap, you won't understand the power of the right choice. Here's the first thing most people miss. Liquids are sneaky. They go down fast. They don't fill you up the way solid food does, and they can deliver sugar or starch with very little resistance from your appetite. That means a breakfast that feels innocent can become a blood sugar ambush. A bowl of cereal, a banana, and a big glass of the wrong milk can load your body with a surprising amount of carbohydrate before 8 a.m. And once you start the day with that rise, many people chase energy all day, then blame their diabetes instead of the morning routine. Now let's talk about one of the most overpraised options in grocery stores, oat milk. I know it has a health halo. I know it sounds earthy and clean and modern. I know people hear oats and imagine fiber, heart health, and stable glucose. But the reality is that oat milk can carry more carbohydrate than many people realize, and some versions contain added sugars on top of that. Even when it isn't sweetened, it can still be more carb-heavy than better options. So if you are pouring it freely into coffee, cereal, smoothies, and protein shakes because you think it's automatically diabetic friendly, you may be creating a daily blood sugar climb without noticing it. For some people, oat milk is not a disaster. But for many, it is not the smart default they believe it is. Rice milk is even more deceptive because it often looks light and harmless. But metabolically, it can be one of the weakest choices for glucose control. Rice-based drinks tend to be higher in carbohydrate and lower in protein. And that combination is exactly what many people with type 2 diabetes do not need. If you think about what helps blunt a sugar rise, protein can help, fiber can help, healthy fats can help. But a drink that leans more toward easy carbohydrate and gives you very little protein support is not doing your pancreas any favors. So if you have been drinking rice milk because it sounds gentle or because someone told you dairy-free automatically means healthier, I need you to pause. Dairy-free is not the same thing as blood sugar friendly. Those are two very different questions. Now let's move to almond milk, because this one is tricky. Unsweetened almond milk can actually be a decent option from a blood sugar standpoint because it is often low in carbohydrate and low in sugar. That sounds wonderful, and in one sense it is, but here's the catch. Traditional almond milk is usually very low in protein, so while it may avoid a big glucose hit, it often doesn't give you much staying power, and staying power matters. If your breakfast drink is low in carbs, but also low in protein, you may still feel hungry fast, and that hunger can drive snacking, grazing, and a second breakfast you didn't plan on eating. So almond milk is not a villain if it's unsweetened, but it also isn't the strongest all-around choice for most people trying to stabilize appetite, glucose, and weight at the same time. Then we have the flavored plant milks, the vanilla versions, the chocolate versions, the barista blend versions that taste almost like dessert. This is where labels become dangerous theater, because people see almond, soy, coconut, or oat on the front and never look at the added sugars hiding on the back. That is a huge mistake. Health professionals consistently warn people with diabetes to choose unsweetened versions of plant-based milks for a reason. Those flavored versions can pack enough added sugar and total carbohydrate to make blood glucose control much harder. So if you are saying, "But doctor, I only drink plant milk," I need you to hear me clearly. Plant-based does not protect you from sugar. The label that matters most is not the marketing on the front. It's the carbohydrate and added sugar line on the nutrition panel. Let's talk about regular dairy milk, because some people swing too far in the other direction and start fearing it unnecessarily. Plain white dairy milk does contain sugar, but that sugar is mostly lactose, the naturally occurring sugar in milk, not added sugar. And that distinction matters. A cup of cow's milk also gives you meaningful protein, which helps make it more balanced than many sugary beverages. But balance does not mean unlimited. Milk and yogurt still affect blood glucose because they still contain carbohydrate. And this is where many people get sloppy. They stop respecting portions because they're drinking something traditional. They pour huge glasses. They drink it with carb-heavy meals. They use it in smoothies with fruit, honey, and oats. Then they wonder why their numbers rise. So plain milk is not poison, but it is not automatically protective either. And there is another trap, one that catches people who think they found a clever loophole: lactose-free milk. Many people assume lactose-free means sugar-free, and that is simply not true. The lactose is broken down, not erased. That means it can still influence blood glucose, and in some cases, it even tastes sweeter because those milk sugars have been split into simpler forms. So if you switch to lactose-free milk believing it would be a free pass for your diabetes, I don't want you panicking, but I do want you waking up. Lactose-free can be helpful for digestion. It is not a magic blood sugar hack. And once again, that's the deeper lesson in this whole conversation. Your metabolism doesn't care about trendy assumptions. It responds to the actual carbohydrate load, the actual protein content, the actual added sugars, and the actual portion you drink. So where does soy milk fit into this? Because this is where things start getting more interesting. Unsweetened soy milk is one of the strongest non-dairy options for people with type 2 diabetes. Why? Because nutritionally, it comes closer to dairy milk than most plant milks do, especially in protein. That matters more than people realize. Protein helps with satiety. Protein helps make a meal feel complete. And when a drink gives you decent protein without